So it gives me great pleasure to introduce and to interview these two longtime friends, Dr. Dermot Canavan and Dr. Rich Cohen. Gentlemen, maybe you could tell us a little bit about yourselves, about your practice, and what brought you to the SCDA IADH conference.
Dr. Cohen, would you like to go first?
Well, certainly, my practice is limited to treatment of orofacial pain disorders, TMD, neuropathic pain, migraine, sleep disorders, and my training was mostly at UCLA, and I've been on faculty there for about 25 years. And I got to meet Dr. Canavan when he was a resident there some time ago. And I was invited to speak at this conference by one of the deans at our dental school, who is in charge of the special needs department, and I run the orofacial pain clinic in the dental school. So she asked me to get together with Dermot, who she met in Ireland, and was very impressed when she met him at a conference. And so we could cover the relationship between orofacial pain treatment and special needs.
Fantastic. Dermot?
My name is Dermot Canavan. I also work in the field of orofacial pain management. I'm based in Dublin and London. I lecture and do a little bit of research. This morning's presentation was on the diagnosis and management of orofacial pain complaints in patients with physical and intellectual disabilities.
And how was your presentation received?
I think the presentation was very well received. It was quite interactive with the audience. Many of the audience were very specialized in their own field, but very few people had extensive training in orofacial pain.
So for those of us who may have missed the presentation, because there's lots on at the conference, could you give us your key take-home messages?
My key message was that the diagnosis of orofacial pain in the general population is a challenge. The diagnosis of orofacial pain in a population that requires special periodentistry is an even greater challenge. But we have to modify our techniques. We have to think laterally to try and solve some of the problems. And that's really what we were discussing this morning, to see if we can come up with new ways and innovative ways of dealing with these issues.
Great. Dr. Cohen, did you get any interesting questions from the audience?
We had some good questions from the audience relating to the difficulties of dealing with the special needs population and how to get input from patients who don't communicate very well, and also about any research that's been done about the relationship of orofacial pain to some of these issues. And it did come out that we don't have enough research, for instance, with the autistic spectrum, in terms of how that spectrum might affect orofacial pain. So a lot of the questions spurred an idea of interest in what other areas we needed to do research. We also saw that the dentists who were present did have some experience with orofacial pain, but at least half the audience was not doing routine screening for orofacial pain disorders, and therefore we're hopeful that we had an impact with our lectures on getting them to look for these disorders more amongst their patients.
Great. So hopefully good consequences for the dentist, but also for their patients.
Exactly.
Gentlemen, thank you so much for agreeing to do this interview, and enjoy the rest of your stay in Chicago.
Thank you.
Thank you very much.